Well, good afternoon, everybody. Thank you for joining us today for our bi-monthly research spotlight, which is part of the Minnesota Stormwater Seminar Series. My name is Maggie Karshnia, and I will be your moderator this afternoon. To start things off, I'm just going to give you a quick little background on the research spotlights. These spotlights are intended to highlight the research results from the recent projects completed through the Minnesota Stormwater Research Council and the Center. And they are also intended to highlight how this research can be applied and how it's used to improve our planning, practices, and policies here in Minnesota. These spotlights are paired with our every other month seminar series brought to us from St. Anthony Falls Laboratory in partnership with the Water Resources Center. The seminar series brings in nationally recognized stormwater experts to talk about key topics. You can learn more about these upcoming opportunities for the seminar series and the research spotlights by visiting our website on the screen. And just in case you might have missed one, a quick reminder that all of these past seminars and spotlights are available for viewing on the Satoshi YouTube channel. You can find these links either on the seminar series website or by following the link above. I would like to take a moment to thank our co-leads on the seminar series, Dr. John Gulliver and Dr. Andy Erickson, for all of their work and for all of their great support that SAFL's provided for the series since 2019. And just a reminder too, that if you wanted to learn more about any of the projects that are highlighted during these research spotlights, you can find them on our website. The area circled in green that you'll see on the screen, that's the link to learn more through mid-project presentations, final reports. We have links to our videos on there as well. And I just wanted to kind of throw it out there too, that our website is in the process of being updated. So next time you visit it, it might be renewed. And so please check that out. I did want to mention too quick that the call for nominations is open for the Council Advisory Board. Now this council is made up of about 20 representatives, and it gets to set the research priorities for this program. It acquires funds to support the research, and it gets to select the projects to award and complete. So if you wanted to say like on the next research projects that this program tackles, you definitely want to be on this council. So you have to apply by October 31st. The link is on the screen. We're looking for tribal community staff, watershed districts, cities, a variety of folks. You definitely want to check out the website to learn more, and I hope you'll apply. I also wanted to give a quick plug for the next presentation. So this one is going to be part of the seminar series, and it's going to highlight Ken Schiff. He's the Deputy Director of Southern California Coastal Water Research Project, and his topic is going to be on assessing ecological impacts from urban stormwater to rivers, streams, and estuaries. It's definitely going to be a good presentation and one you're not going to want to miss. Whew, okay, that was a lot. So that brings us to today's research spotlight, which features a completed project funded through the Minnesota Stormwater Research Council. Now, this month's theme is stormwater reuse and human health. And as some of you might remember, at the January 20th Research Spotlight last winter, we heard a presentation from Dr. Satoshi Ishii on his recently completed research on contaminant removals in different stormwater reuse systems. The Minnesota Department of Health was a partner on this project and also came out with a report in January on the reuse of stormwater and rainwater in Minnesota. Now, the Department of Health is a national leader on the topic of stormwater reuse and public health, and they're going to give us some insights today on how they incorporate the latest research into their recommendations and how the research by Satoshi Ishii might change these. So Dr. Sybil from Colorado State University is also joining us today, and she's going to be highlighting a current research project that the Minnesota Department of Health is a partner on, and her insights into the future of stormwater reuse. Now, a quick note before we get started, if you have questions for our panelists, please use the Zoom Q&A to submit your questions. And if you like someone's question, I encourage you to give it a thumbs up. The more likes a question has, the higher it's going to rise on the list. And we're going to answer those questions first. So remember, use the Q&A function of Zoom to do that. Okay, and with that, I would like to introduce our first two presenters today, Nancy Rice and Anita Anderson. They're going to start us off with a presentation on the Minnesota Department of Health recommendations from their recently released report that I just mentioned, and how they incorporate newly completed research into their current recommendations, as well as their latest updates for Minnesota stormwater managers. So Nancy Rice has a master's in public health from the University of Minnesota and is currently a research scientist with the Minnesota Department of Health. She studies human health risks related to water use. She is joined by Anita Anderson, who has over 25 years of experience as a stormwater supply engineer with the Minnesota Department of Health. Welcome, Anita and Nancy. I will let you take it away.
All right, great, thank you. I think Anita is going to start us off.
Yeah, thank you. Both Nancy and I appreciate the opportunity today to speak with everyone about some work related to the public health aspects of stormwater reuse that the Minnesota Department of Health and our partners have been conducting over the past few years. So I'll start off with some basic background, then I'll hand it off to Nancy to speak more about the risk assessment, and then we'll conclude with some recommendations and next steps. And before I get started, I just wanted to provide a couple of definitions that we'll be using in our presentation. So stormwater reuse, also sometimes called stormwater capture and use, we're defining as precipitation that falls over the ground before being collected, whereas rainwater is precipitation that lands only on a roof surface and does not touch the ground. So just making sure we're all on the same page there. Next slide. So, you know, most of you on the call probably know that water reuse is happening in Minnesota, and it's been happening for quite a while. These two charts just kind of show approximate percentages of the types of reuse that are happening. You can see that sources of water include stormwater, along with wastewater and rainwater and a little bit of gray water. You know, in our state, wastewater reuse guidance has been around for a long time, and those systems are permitted, so we have a good idea of the number of systems in the state. Whereas stormwater reuse systems are not currently permitted, so we don't have an exact count of those systems, but we do know that the interest in stormwater reuse has really been gaining momentum over the past several years. And we'll see that most of the end uses are primarily non-potable or non-drinking water uses like irrigation, toilet flushing, vehicle washing, and a little bit of industrial use. Next slide. You know, so we're at, you know, people are investing time in this topic because we see that stormwater reuse benefits Minnesota. In particular, you know, safe and sustainable water reuse is an important part of the overall management of Minnesota's water resources. In particular at MDH, we see several benefits related to water reuse, including the slowing down or trapping of contaminants in stormwater before they reach surface water bodies, especially those that might be used for drinking water or other public uses. We can see that it could reduce the impact of times both with low precipitation or drought conditions, as well as managing water to control flooding during times with high precipitation. I think one of the Q&A questions was about you know, especially beneficial in those places where infiltration is not possible. So while we see the capture and use of stormwater is beneficial, we also need to make sure that the practice doesn't bring in risk to people's health, especially in contexts where they might assume the water is of drinking water quality, such as in buildings. And with that, I will hand it back to Nancy.
All right. So as Anita was saying, let me move my slide forward here. Oh, there we go. So as Anita was saying, we are at Minnesota Department of Health interested in facilitating more development of water reuse, and we are interested in it as a practice. But as Department of Health, we need to understand what health risks there are related to it and make sure that it's not imposing new health risks that haven't existed before. So as also Anita said, stormwater is water that falls from the sky and runs over the ground before being collected into a collection system. So why are we concerned about it? Well, as it runs over the ground, it can pick up debris, chemicals, and pathogens. And as you've probably all seen, there's always things on the ground like dirty diapers or that people have thrown out, or pet waste, or animal waste, or even human vomit, and any number of other things. So all of that could end up in the stormwater. And we needed to understand more about that to ensure that it doesn't pose an additional risk to people. So we actually started talking about water reuse in general way back in 2016 at Minnesota Department of Health. There was an assembly of representatives from various interagency on an interagency group. So we got a lot of people from state agencies and other organizations to talk about water reuse. Over about 18 months, we talked about various types of water reuse, like wastewater and stormwater and rainwater. And in the end, we came up with a report called Advancing Safe and Sustainable Water Reuse in Minnesota that is currently available on our website. And in the report, we have some recommendations. After that report was done, there's still interest in getting more information specific to Minnesota. So what types of things might happen in Minnesota's climate, and might it be different than what happens other places? So Minnesota Department of Health proceeded to get some Minnesota data. And part of that process was partnering with the University of Minnesota, with Dr. Satoshi Ishii's lab and his graduate students, including Tamara Walsky, who I believe is on the call today. And we also worked with Dr. Tim LaPera's lab and his graduate students. They did some sampling of stormwater systems in Minnesota so we could get some Minnesota specific data for stormwater systems specifically. In the meantime, at Department of Health, we also gathered more information from other states and other countries. And with all of the information that we were able to gather with the help of water reuse system owners as well, we performed a risk assessment. And after doing our risk assessment in the white paper that we published, we do propose some areas for further discussions. And I should mention that white paper is also currently on our website. It's called Reuse of Stormwater and Rainwater in Minnesota, and a public health perspective, and it is there for everyone to take a look at. In the report, we also offer some risk management options. So this is just a snippet of data that you'll find near the back of the report. This is just kind of a compilation of some of the most commonly detected bacteria pathogens and the maximum concentrations that they were found at. So this is a vertical bar chart, and it has a y-axis of log 10 genetic copies per liter. There are 6 columns, and the first column is human Bacteroides at 5.9. Now, human Bacteroides isn't necessarily a pathogen, but it can be found in human fecal material. So its presence is an indication that there could be human fecal material in the stormwater. The next column is Legionella at 3.5. And this isn't also necessarily a human pathogen, but it can proliferate and when it's aerosolized, it can cause disease in humans like Legionnaire's disease and Potomac or Pontiac fever. The last 4 columns are Salmonella and Shigella, and those are intestinal pathogens in humans. They cause diarrhea and vomiting, and we found those at maximum concentrations of 4.8 to 5.8. So while we did find pathogens in some of the samples, there were other samples that didn't have pathogens. So sometimes the stormwater was actually fairly clean. So those detections are sporadic, and our conclusion is that stormwater is heterogeneous. We don't really know why that's occurring. There could be all kinds of variables that we need to think about. One of them we initially thought about was maybe the surrounding land use. And I think maybe, as Dr. Sharvelle might say, we're not sure if that's actually the reason that there's variability yet. That kind of is being looked at, and maybe we'll need more research even. There's also some variability potentially with the system collection and storage design. So that might be another factor, but it also could use research as well. There are also some data challenges related to stormwater reuse, and one is just that there's a wide variety of systems. There's all kinds of different designs, and they're in different locations and use different filter or treatment systems. So it's difficult to get enough data to get a really good representation. There's also some variability on how often we could collect the samples. Usually we just had grad samples, and if we had an ideal situation, we'd be able to do continuous monitoring, but that just isn't a possibility. Genetic data can also raise some variability questions. There's some differences in how the data is interpreted. There's really no standardized way because it's relatively new. So some scientists might censor it at a higher level than other scientists, and then some of the data might not be included, while other scientists want to include the data. So that's another source that could lead to varying results in conclusions. And finally, the genetic data, right now, it's not completely clear whether what we find as far as pathogens are actually infectious or they're non-infectious. They might be able to cause infections in humans, but it's something that's not necessarily standardized and established through the genetic data processing yet. So in our risk assessment, we assumed that what pathogens were found were infectious, and we took all of the data that we had and conducted a risk assessment. So we took a conservative approach, and we combined hazard and exposure data, put them into calculations, and came up with a number. And that number could be compared to common benchmarks, and this benchmark that we used was 1 in 10,000 infections per person per year. So if you have a community of 100,000 people, you would expect in 1 year to find 10 infections on average. Now, this is just one example of a benchmark, as I said, and sometimes the risk was higher than this benchmark for untreated stormwater, but there are other benchmarks to use as well. And there are other management processes for treating stormwater, which Anita will talk about next.
Thank you. So as Nancy said, once we've established that there is a potential risk from stormwater reuse, then we want to look at ways to manage that risk. And one way to manage risk is just by the choice you make in the application you're going to implement. So what is acceptable risk, as Nancy said, might depend on what the community subject to the exposure is willing to accept. And determining that acceptable risk might involve input from multiple interested parties. But on the chart here, we've just tried to show 3 examples of potential water reuse scenarios and the associated risk. So here, the highest risk shown would be using untreated stormwater in indoor applications where we have both the highest dose of the microbes in the source water and also the highest exposure volume for the end use. The middle risk is shown as untreated stormwater for unrestricted irrigation. Again, where you have still a higher load of microbes in the source, but maybe your exposure volume is a little bit lower. And then the lowest risk shown here is on the right, untreated rainwater used in restricted irrigation. So we have both a lower contaminant load usually in rainwater, and then if we're restricting access to that irrigation, we're going to reduce the exposure volume. So again, depending on the benefits offered by the reuse, maybe higher risk scenarios are worth the risk trade-off or are worth additional ways to manage the risk. Next slide. So some controls to manage the risk, in addition to just those choices, are treatment. So treatment can be a primary control of risk. Treatment can come in a variety of forms, whether it's pre-treatment or filtration, disinfection, or wetland treatment. And kind of the nice thing about treatment is it can provide a consistent barrier to contaminants and really can be designed to manage a really wide variety of conditions and risks. Another thing that can be used to manage risk is just ensuring that the systems are well maintained and functioning properly. Probably the biggest risk is a system that's not maintained, and therefore water quality conditions can actually deteriorate in the system and make it worse than what you started off with. and maybe even bring in additional hazards. The other thing is just operator training, making sure everybody involved with the system, not just maybe the owner or certain people are aware, but make sure those operators know the ins and outs of the system and how to keep it functioning properly. And then finally, ensuring the financial soundness of the system over time. We've seen what happens when we can't maintain our infrastructure, and we just want to make sure that these systems are supported for the long term. Next slide. So people have asked, what are some of the next steps, at least from the agency level or the Minnesota level? So we do have some Clean Water Fund money to continue the efforts around water reuse. COVID did delay the process, but we are starting that process again. A project charter has been developed and approved by an interagency coordination team. We've had new leadership since the prior project, since the prior report came out. So we're just kind of getting everybody on the same page as we start the new project. And really this, the previous project tried to incorporate all those sources of reuse we saw in the earlier slides. This one is going to focus more specifically on stormwater and rainwater. And we've kind of heard from the interested parties that we worked with previously that, what people are wanting is practical guidance, a clear pathway for any government approval. We want cost-effective risk management, both for human exposures and any environmental protection that's needed. There's a high level of interest in multiple purposes, whether it's meeting stormwater permits or improving resiliency for groundwater sustainability. We want the cost effectiveness to be very, considered in anything going forward. Want to be able to meet, resiliency during peak irrigation or high water demand periods, while at the same time, protecting source waters. And we've heard definitely a need, for funding of these systems if we think they're important. We want to provide, look for ways to find that funding support. And then finally, just want to include outlining a clear description of any data gaps to inform the Minnesota context and our microbial risk assessment. And again, the nice thing that now that we've done the assessment and we've worked with partners like Dr. Sharvelle to do that, we have the ability to adjust our assessment as new data comes in. And so with that, we look forward to ongoing work and partnerships. And I will hand it off to maybe back to Maggie. Great.
Thank you so much, Nancy and Anita. That was a great presentation. Just a reminder to participants that if you have any questions while the panelists are speaking, you can put them in the Q&A function. I see there's already 9 questions in there. So if you like any of those questions, please be sure to give it a thumbs up. Like again, those are going to rise to the top and we're going to answer those first. So our second short presentation is by Dr. Satoshi Ishii and Tamara Walsky. So the Minnesota Stormwater Research Council selects high priority research projects for funding, including the recent work completed by Satoshi and Tamara on the evaluation of contaminant removals in different stormwater reuse systems. We're going to be hearing a short presentation from them on this work and how the research can be applied to the best management practices here in Minnesota. Dr. Satoshi Ishii is an associate professor in the Department of Soil, Water, and Climate, as well as the BioTechnology Institute at the University of Minnesota. He's joined today by Tamara Walsky, who is a former graduate student of the University of Minnesota and an environmental and One Health microbiologist. Welcome, Dr. Ishii and Tamara.
Okay, yes, thank you for inviting me to present at this event. We want to share with you about our recent work and to discuss what we should move from there. So this work was, sorry about that. Okay, so this work was done in collaboration with MDH, Nancy and Anita, and and also Tim Lapara in the civil engineering department in the University of Minnesota. As Nancy and Anita explained in their presentation, the water reuse has some benefit. And I want to emphasize one more thing. Since the water demand has been increasing in the past 30 to 40 years, it is the importance of water reuse is also increasing as well. So reusing water, especially stormwater, can minimize the groundwater demand and also protect surface water quality. The question remained unanswered will include whether or not pathogens are present in the treated water. And also what kind of treatment process are most effective to remove microbial contaminants. To answer these questions, we have done several research projects. One of the project was funded by LCCMR. We collected various reuse facilities in Minnesota and tried to obtain the overview of the status of Minnesota water reuse. Here is the summary of the LCCMR project. We collected water from several reuse facilities, and what we found was that most of the sites use stormwater or rainwater. So stormwater reuse sites occupied about 60% of the sites, and the rainwater reuse sites uses about 1/6. So combined, about 3/4 of the sites uses either stormwater or rainwater as the source. And most facilities uses coarse sand. Coarse sand filtration is most commonly used, which is shown in the brown pie here. And less commonly used is UV and chlorination. So UV is this orange and chlorination is yellow. And some sites didn't do any treatment. And the reuse type, for the reuse type, irrigation is the main application. More than half of the sites uses their water for irrigation. So since most sites uses stormwater, for the next phase of our project, we focused on stormwater reuse. And this project was funded by Minnesota Stormwater Research Council. So in this project, we focused on 5 reuse facilities around the Twin Cities metro area. Okay. So this is the sites we used. So 2 sites uses coarse sand filtration and chlorination, and some sites uses UV. So for the treatments, there are 2 types of treatment: filtration and disinfection. Chlorination and UV are the type of disinfection which is designed to decrease the amount of pathogens. Whereas filtration do not necessarily remove pathogens, especially bacteria and viruses. So for example, Scott County sites only have the filtration, therefore the system is not designed to remove bacteria and viruses. We wanted to include these sites to compare whether or not this disinfection is effective. The conclusion of the phase 1 study is that the precipitation could influence the stability and occurrence of E. coli and antibiotic resistance genes, but this trend is site or system dependent. And the overall detection of the genes compared across 5 sites shows that the Ramsey County site, which has the UV disinfection and a series of filtration, provides the highest quality of water as comparable to tap water quality. But it is also important to note that this site uses rainwater, not the stormwater. And also their application is toilet flushing, where the other sites uses their water for irrigation. So based on this results, we moved to the phase 2 study, in which we focused on 2 sites, and we collected water samples more intensively. We selected 2 sites, one with chlorination and the other with UV disinfection. And also we included lake water as a reference. And all sites uses their water for irrigation. Based on the summary of these results, we found that the sites with UV disinfection has the lower number of gene detection compared with the sites with chlorination and lake water reuse system. As Nancy mentioned, that we use the DNA-based pathogen detection method, which sometimes cannot discriminate live and dead pathogens. To overcome this problem, we use a special chemical called propylene monoazide to distinguish live and dead microbes. Based on our PMA treatment, we found that most of the viral pathogens are dead or damaged, and therefore they are not infectious. So although we sometimes detect viral pathogens, they are not infectious. They are probably not infectious to humans. We also did some. We also did cost analysis for the water reuse. This is just based on the 2 reuse facilities, and we cannot overly generalize the trend. But based on our analysis, the water reuse has lower cost compared to the use of city water for both sites, either by using the chlorination or UV disinfection. So based on our research, using treated stormwater for non-potable purposes, such as irrigation, could be a reasonably safe and sustainable alternative practice that is comparable to using lake or city water. Also, stormwater reuse can be economically beneficial and environmentally friendly. Stormwater reuse facilities should be carefully designed to maximize the removal efficiency of potential contaminants. Our project was funded through the Minnesota Stormwater Research Council and also the LCCMR. Thank you for your attention. And if you have questions, feel free to let us know.
Great, thank you so much, Satoshi. So if anybody has questions for Satoshi, you can put them in the Q&A portion. It looks like we have like a lot of questions already, 14. And again, if you like any of those questions, be sure to give them a thumbs up so that they rise to the top and we answer those first. So we have one more presentation, and then I promise we will dive into these great questions you all have. So the Water Resource Federation has an ongoing research project on stormwater reuse, which has engaged multiple partners across the nation, including the Minnesota Department of Health. So our next panelist is Dr. Sybil Sharvelle from Colorado State University, who's been working on this national stormwater reuse project. And she's going to provide a short presentation on the project, what insights they hope to gain from the results, as well as her own recommendations for Minnesota stormwater managers. So Dr. Sharvelle is a professor in the Civil and Environmental Engineering Department at Colorado State University and received her doctoral degree from Purdue, where she developed a biological processor for the treatment of gray water for potable reuse during long space missions. Welcome, Dr. Sharvelle.
Thank you, Maggie, and thank you for having me. I will be presenting today on a project that's funded by Water Research Foundation with Harry Zhang as the project manager on that project. And we're working on assessing microbial risks and potential impacts from stormwater collection and uses to establish appropriate best management practices. And this is a collaborative project. We have some partners from Carollo engineers and also, so we have Amos Branch and Jim Rasmus from Carollo, and then like to acknowledge our team member Jumana Al-Jafari and Sarah Milani here from Colorado State University. We have a project advisory committee, which has had a lot of impact on the direction of this project that I would like to acknowledge, and also an expert panel that we have engaged in this process of developing some of the guidance through the synthesis of the data that we've been able to find. So I want to also acknowledge all of this group. I'm not going to read all those names just for the sake of time, but a lot of contributors to this project that should be acknowledged, and a lot of cities like in cities and states and health departments and things like Minnesota that have really helped to provide data and support on this project as well. So in a kind of summary of our proposal here, presentation, we'll talk about the needs to advance stormwater capture and use, some of the project objectives for the WRF project, some guidance on selection of log reduction targets. We'll talk more about what those are, and the use of human trackers to estimate fecal contamination. And we saw some of those human source trackers in other presentations today as well. So where this started really was that there was this guidance that came out in 2017, and also a project that was funded by, well, then the Water Environment Reuse and Reuse Foundation, or also WRF, where there was a lot of ambiguity around water quality requirements for use of different alternate water sources. Gray water, wastewater, and stormwater roof runoff as well was considered, or rainwater. And so we had this panel convened that was organized by National Water Research Institute, and kind of developed a set of guidance for use of these alternate water sources. And the result of that were these tables where we came up with log reduction targets for different source water and end use combinations. Here I'm focusing on stormwater as the source water, because that's the focus of our presentation here today, and as well as the WRF project that we're working on. So what these are is for each virus, protozoa, and bacteria, our group established these log reduction targets, or amount of log removals that would be required for each of those pathogen categories to meet water that would be considered safe based on a 10⁻⁴ person per year benchmark of illness for these different end uses, which are unrestricted irrigation or indoor use. So stormwater was ambiguous then. We heard from some of our other presenters today about sort of the sporadic concentrations of contaminants in stormwater, and the presence of potentially human pathogenic microorganisms are definitely prone to this kind of sporadic concentrations of observance in stormwater. Well, here, I'm gonna just wait a second here. So what we did was to recommend 2 sets of log reduction targets. And those were based on what we considered to be a dilution of sewage in stormwater. So we had a 10⁻⁴ dilution, which would be 10% sewage, or 10⁻³ dilution, or which would be 0.1% sewage. And the idea was that decision makers or health departments or utilities could use these as kind of bounds for selection of log reduction targets based on different characteristics of their systems. It turned out that these were really ambiguous for health departments in the regulatory community. And so part of the motivation of the Water Research Foundation project was to provide a little bit more guidance in this area. So I've already talked a little bit the rationale. Stormwater quality is very highly variable. Consideration of potential sources of sewage was considered a pragmatic approach. This range was consistent with observed pathogen concentrations that were present in nationally collected stormwater. So one question we get a lot is how do we pick these ranges, or this 10 to the -1 and 10 to the -3 sewage dilution? And those were based on actual measurement of human pathogens in stormwater nationally. So ultimately, it did still come out that more guidance was needed on stormwater due to this kind of ambiguity around this range of log reduction targets. So the objective of our work project is to synthesize the existing research on stormwater microbial quality and treatment processes and provide pragmatic guidance for design and operation of these systems. And starting here, we looked at a lot of data that was collected by especially this group Van Beek et al. In 2011. And so this is their collected data, and we've just kind of shown this in these box plots that show the potential ranges of, in this case, norovirus G1. And what we found was that there's not a consistent trend associated with land use for observation of concentrations or presence of these microorganisms. This is consistent across different types of land uses, as well across different types of organisms. I've shown norovirus G1 here, but what we do see is that across all of the different types of pathogenic organisms that are measured in stormwaters, that there's not a good consistent trend for land use. So that complicates things in terms of trying to make decisions with respect to selection within these ranges of log reduction targets for pathogens. So we wanted to look at coming up with ways to kind of estimate the amount of fecal contamination in stormwater. And this graph just shows percent detection in wet weather flows. This left side here, this HF183 and vacuum, those are the human microbial source trackers. These are bacteria that we can measure that are indicative of human fecal contamination. And these are just kind of percent detections of these different organisms. And a lot of these have very low percent detections, which makes it very difficult to kind of get a data set that we can feel very confident about in terms of amount of these pathogens that we expect to see in stormwater. And the story with stormwater is that it is sort of a random thing, and that in terms of these presence of microbial constituents, and that when they're present, they tend to be in fairly high concentrations, and they're not present all the time. And it depends on the sources and different things that were talked about in previous presentations as well. So ultimately, when we were trying to find a way to kind of make an estimate of fecal contamination, we really looked at these human microbial source trackers as being a way to estimate human fecal contamination. They're more easily quantified than the potentially human pathogenic organisms. They're more ubiquitous than human fecal matter, and there's just a larger existing data set. So if you look at these N values here, we can see 926 samples collected with these microbial source trackers versus the different types of organisms, ranging from 40 to about 70 as a maximum for those data sets. So we use these human source trackers to kind of come up with these estimates of a human fecal contamination analog, which is really the same as, it just represents this dilution of sewage in stormwater. So we're basically just dividing the concentration observed of the human source tracking organism by the concentration in raw wastewater on average. So we come up with this HFCA, or human fecal contamination analog, of say 10 to the minus 1 or 10 to the minus 2, where then the fraction of sewage in 10 to the minus 1 is 1/10, and percent sewage is 10%. So we've kind of recommended this as a way for practitioners to be able to estimate the contamination of human fecal matter in sewage. We wanted to really relate this back to stormwater treatment processes, and kind of determine based on the log reduction targets that would be associated with a particular HFCA or human fecal contamination load, and understand then the treatment that would be required based on those log reduction targets. So what we saw here is, looking across these different HFCAs, we need microfiltration and ultraviolet, which are really common treatments for stormwater. But then to meet log reduction targets for these higher fecal loads that were estimated, we'd have to add free chlorine, chloramine, or ozone in addition to this relatively high ultraviolet dose, which creates a lot of complexity really with stormwater, because chlorine can combine with ammonia present in the influent stormwater, which is kind of also very highly variable in stormwater, and make chloramines, which makes it difficult to dose the chlorine properly to get credits for the chlorine. So you need a lot of system controls for that, or you have to use chloramine, which requires really high concentrations, or ozone, which has complexities associated with it as well. So we kind of really determined there's this cutoff at this 10 to the minus 4 HFCA, or 0.01% sewage, where the complexity of the design decreases. So we wanted to kind of inform a process moving forward to kind of that could inform this sort of minimum treatment requirement. And unfortunately, because there's not adequate predictors of stormwater microbial quality, we've really determined that monitoring is needed to justify selection of log reduction targets based on a 10 to the minus 4 HFCA. So there's these two options we're thinking about. One is conservative treatment. In conservative treatment, you can treat the stormwater to the 10 to the minus 1 HFCA, which is the higher log reduction targets, kind of more extensive treatment, and not have to monitor your system. You can assume this is a really conservative level of treatment for stormwater. The option 2 category that we think about is that you could monitor for human microbial source trackers with a 10 to the 4th threshold for treatment that would meet this minimum treatment, or the kind of microfiltration and ultraviolet level of treatment, which is consistent with the 10 to the minus 4 human fecal contamination. This is, and basically what we're saying is you could monitor, show your stormwater meets this, and then you would have to at least every couple months make sure there's not presence of contamination in the new presence of contamination from leaking sewers or other potential sources in the system, to make sure you can stay within that minimal treatment category. So in summary, selection within the range of log reduction targets is ambiguous. Our extensive review of data has shown that really is ambiguous, because there's not good predictors for stormwater contamination with fecal matter. Treatment process train requirements are not vastly different across the original range that we recommended, from that 10 to the minus 1 to 10 to the minus 3 human fecal contamination or sewage dilution. But selection of log reduction targets for the 10 to the minus 4 does simplify the treatment processes and the autonomous control that's required for those systems. So we wanted to provide this as an option for those that have the capability to be able to maybe do some additional monitoring and get into this kind of lower treatment requirement category. Monitoring of human source trackers for minimum treatment level offers these benefits because it does offer the potential to have a more kind of pragmatic treatment system with less monitoring and controls that are required on that system. And you know, and then we do have this issue that what we're recommending really is still periodic monitoring about every 3 months to make sure that there's not new sources of contamination entering that stormwater, since leaking sewers can kind of happen at any particular time. So with that, I will go ahead and conclude, and sounds like we can go into a question and answer.
Great, thank you so much, Dr. Sharvelle, that was great. So we'll just ask like a couple of questions to start us off, and then we'll dive into the participant questions. So this can be answered by any of the participants or the panelists. The first question is, what do you think are the key success factors for those communities that have safe and cost-effective stormwater reuse systems? What advice would you give to those getting started?
So this is Nancy. Sure. So yeah, one of the success factors that we think is that water system operators or owners that are willing to really monitor their systems and make sure that everything is functioning correctly, that if they have treatment on there, that it's working correctly, if they have filters, that the filters haven't become clogged, and that they're open in general to sharing information with each other and kind of learning from other system operators, if that's possible, to see what's working and what's not working. There's some unexpected things that can happen. We've heard from talking with some of these water system owners that, you know, they didn't realize maybe there was going to be insects in their filters or, you know, things like that happening. So I think a successful operator and owner is willing to kind of experiment a little bit and listen to what other people are doing and finding, and kind of being flexible that way.
Yeah, and I would just echo that, you know, as I think I mentioned in the talk, it's just kind of committing to the system for the long term and understanding it's not just kind of installing it and leaving it alone, but it's just, you know, paying attention to the operations and impacts over time.
What about you, Satoshi? Do you have some key success factors that you can share?
Yeah, I agree with Nancy and Anita. And one thing I want to add is the system facility knows the use of clear. So whether or not they have clear reuse objectives, and they have appropriate systems to meet their objectives.
Okay, Sybil, how about you?
I definitely think that flexibility is important, which I think creates complexities for regulatory aspects, because you can't treat all projects the same. I think when it comes to stormwater and stormwater capture and use, there's so many different considerations with the sources, treatment pathways, and end uses. But in order for systems to really stay cost effective, I think that we have to have regulatory processes in place that allow some flexibility in terms of how these different standards can be met.
All right, let's go into the next question. What knowledge gaps in stormwater reuse do you think we still need to fill in order to make public health risk acceptable to society?
I can go ahead with that one and start things there. I think that I mentioned, I think a couple of times in my presentations, the lack of data. Minnesota's done a great job to collect a large data set on microbial quality of stormwater, which has been really useful for our project. Nationally, still we're in a place where there's not a lot of data on stormwater microbial quality, and particularly kind of for me, something that's really important based on our work and the guidance we're providing is looking at these human microbial source trackers and how they actually track with the pathogens and the presence of wastewater contamination in stormwater. So really gaining a better understanding of ways that we can categorize stormwater across these different levels of contamination through measurements of both microbial source trackers and human fecal, and potentially human pathogens as well, would be really beneficial in moving forward. I think our panel and research group feels really comfortable that 10 to the 1 HFCA sewage dilution or 10% sewage, which sounds like a lot, is a conservative level of treatment. So if we treat to that level, I think we can feel very safe about the use of stormwater, regardless of different potential contamination sources, but it also is a lot of treatment. And I'd like to see approaches where we can get into more pragmatic, lower cost treatment by being able to predict a little bit better about the potential fecal contamination.
I'll just say it's, Sybil said we have a large data set in Minnesota. Of course, we feel like it's very small and still have lots and lots of questions. We mentioned just the variety of systems and all the different factors that can impact the water quality in these systems. So I think we always want more data, and I think it's coming up in the Q&A that the other sides of it we need to. This today has been primarily focused on the public health side. We need to bring in those cost questions and what is acceptable. That's different for different people, and how do we weigh all those things together. So that's going to be important to consider all those other factors going forward.
Yes, and then we also, we measured various pathogens in the stormwater reuse systems, and we are trying to find the easy to measure parameters that correlate with the levels of pathogens, but it is still difficult to find those parameters. So we cannot measure pathogens in many reuse systems. So if we can obtain a good parameter to predict the pathogen level, that would be easier to apply for other systems. So that kind of parameters is still lacking. I'm interested in the Sybil's HFCA parameter, how that is related to our pathogen concentration data.
Do you want me to respond to that? Sure. Okay. So the correlation, there's several studies that sought to correlate the presence of human fecal the human microbial source trackers to pathogen concentrations, and there's complexities there with everything, as always, especially because the detection rates are low for human pathogens in stormwater. So there's not been extremely good correlations between presence of potential human pathogenic organisms with the microbial source trackers. But there are, there's an indicator that there's reasonable correlation. And we do know that the human source trackers do indicate human fecal contamination, and there's a good detection rate of those, and they're easier to measure than the pathogens. So the microbial source trackers seem to be a reasonable path forward for making an estimate of how much fecal contamination may be present.
Tamara, I see you have your camera on. Did you have anything to add to this one?
So I guess like all types of like fomites or surfaces, especially those submerged in water, they're biofilms, and where biofilms grow, what are biofilms, you know, surrounding equipment in stormwater ponds like. To my knowledge, there has, you know, been no, I guess, work on it, and as well as like, I guess how to best, I guess, clean or manage them, because biofilms can be a good sink for, you know, microorganisms of all types, including pathogens, but then and especially hard to it's a matrix that's very hard to get rid of. So looking into, I guess, that specific type of microbial environment within stormwater systems.
All right. And so those great answers. I think I'm going to move on to the participant questions. We have so many good ones coming in. The first one is for Dr. Ishii. Your data showed that most of the pathogens detected were not infectious. Why did the MDH analysis assume that the pathogens were infectious? Maybe it's more of a question for Nancy and Anita.
I want to add, I want to clarify one thing. So the most of the viral pathogens are not infectious, but bacterial pathogens are still alive. Some of the bacterial pathogens are still alive based on that based on our PMA treatment analysis.
I guess just one question for clarification, Satoshi. Were most of those ones, or the data you showed, was that for the post-treatment samples or the pre-treatment where you did PMA?
I think we combined all samples together, and then based on the combined samples, most viral pathogens are not infectious. Is that right? Tami, correct me if I'm wrong.
Yeah, so I guess in our analysis, we assumed things were infectious because, again, we were looking at, you know, bacteria and virus and some of the protozoa, which not all of those were analyzed for being infectious or not. And we were also seeing, we didn't show the data today, but the culture data that we did for kind of the more traditional path indicators like E. coli and coliform, you know, we did culture bacteria in these systems too. That shows that those were living organisms. So that's why we chose to assume things were infectious. But Tammy, I might have interrupted you, so sorry about that.
All right, our next question is, did the risk assessment you mentioned taken into, I think this is for Nancy and Anita, did the risk assessment you mentioned take into account in evaluating exposures, potential die-off of bacteria following deposition into drainage basins and or potential regrowth? Irrigation with water from detention basins often occurs long after the precipitation runoff events that resulted in the runoff.
Yeah, I can start with that, and then Anita, if you want to fill in anything. But yeah, the samples that were taken were basically grab samples, so we don't have like a over time, you know, a time series of samples. They're just kind of one sample taken. I know a lot of times they tried to get out after a rainfall, but I don't know if that always worked. Maybe Tammy could fill in on that a little bit. But yeah, it would be great if we could have data that would show kind of the time series and, you know, if there was die-off occurring, but really we just kind of had to go with what samples we had, which were, you know, just a few taken when it was feasible to take them. So yeah, it's difficult to say. There could definitely be die-off. We suspect that probably sunlight helps a little bit with that, but we don't really have the data to show that. So we just kind of have to go with the data that we do have for now.
I can add to that.
Go ahead. You go ahead.
I can add to that just a little bit in that because we looked at that in our Water Research Foundation project as well, and just data on pathogen activation with storage. I think the sunlight could increase things more, but for example, you could get maybe 1 log reduction of bacteria of pathogenic bacteria in a month to 2 months of storage. And so that's not very much log reduction compared to the concentrations we see. And it's a really long storage time is also. I do think there's likely cases where there's more inactivation depending on how a system is designed with UV exposure and some things like that could be proven out. But in general with storage, there is reduction, but it's very slow over time. So I just wanted to point that out.
Anita, did you have anything to add to that?
No, I think maybe, she got at some of those things. It's just, those are variables that seem harder to control. I mean, if people are committed to saying, yes, we're going to store our water in this pond for this amount of time, that could be a control if it's shown that there's that DIF in a given amount of time. But right now the systems don't seem to be at least set up to kind of control, if you're pulling out right after a rain or not, or if you're leaving the water in the pond. So that could be something that could be an additional control if you manage it that way.
All right, our next question is, can you comment on risks from untreated stormwater? You stated that treated stormwater is acceptable for irrigation, but can you comment on the extent that untreated stormwater is acceptable for irrigation? Additionally, can you comment on these public health risks compared to not implementing reuse when the runoff would otherwise drain to recreational use waters? This might be for Satoshi.
Yeah, so we included one site where they didn't do treatment, but based on our pathogen gene measurement, I think their pathogen occurrence is not as high compared to other systems. So for that particular site, I think, we didn't do any risk assessment for that site yet, but based on the gene detection level, I think they are okay for irrigation. But again, that is only for that particular location. I'm not sure for other sites.
Yeah, and so I guess, for our risk assessment, we chose to only use untreated source data, just to say this is what most people are going to be starting with, and does it need to be treated to be acceptable risk. So, our assessment kind of looked at the untreated and kind of checked on whether those log reduction targets made sense to provide treatment. So yeah, again, based on our assessment, we would say most of the time untreated stormwater would not be acceptable. That there might be those rare cases where off a certain roof where you're kind of getting a clean collection source, but we generally came to the conclusion that at least some treatment would be required.
Yes, it depends on the source. Oh, yes, source water. Source water. The sites my group worked on has very special source type. So I think we cannot use that to generalize our conclusion.
Okay, this next question is for the whole panel. It seems important and useful to compare the risks associated with using stormwater for landscape irrigation to existing common conditions. We currently have hundreds of thousands of fields and play areas where pets and wildlife defecate when the fields are not in use. We have hundreds of thousands of fields and play areas. Looks like you repeated that. With long runs of inexpensive pipes that are installed by personnel with minimal training and operating with no monitoring, reporting, or standardized operating protocols. It seems appropriate to compare the pathogen loads and concentrations on fields and play areas irrigated with stormwater from construction ponds with these common existing conditions. Please explain why neither the MDH or WERF reports consider these comparisons? Are there plans to gather data to support such comparisons?
I can go ahead with this. I think that there is a reality that these new systems, and even though stormwater capturing these systems have been around for quite some time, decades really, but these uses of different alternative water sources at smaller scale, there's a reality that the processes are under more scrutiny than maybe some things that would have been in place for many decades. So there aren't those sorts of comparisons in place, but what we can say is that our risk assessments are looking at treatment to meet the exposures that we can estimate based on best possible data of how much water may be ingested during an irrigation event where someone may be walking by, or maybe hand to mouth with kids playing in those areas. So we know something about the doses or the amount of intake of the stormwater that happens in those situations. And we're working with this 10 to the -4th risk benchmark for acceptable level of risk, which is what we accept for our drinking water systems. And the reality is that there may be things happening that could be more dangerous than applying untreated stormwater as an irrigation in a park. However, we have data in front of us, and we've done the risk assessments, and we've set these targets. If you want to change and say that a higher level of acceptable risk of illness is okay for a particular constituency or whatever, then one could do that and have a lot less treatment of the stormwater. But the data show that to meet that acceptable level of risk, that this is the level of treatment that's required. And we have a problem with stormwater because it is the contamination is highly sporadic, and there's cases where potentially there's not even potentially human pathogenic organisms present, and then all of a sudden they show up, and they're at fairly high concentrations when they show up. And so if we want to design these systems to be protective of public health and with the kinds of risk levels that we've come to accept in our other water systems, then this is the kind of treatment that's required at this time to meet those targets. And I think there's a lot of other high risk activities that potentially occur, and those all have to be weighed by decision makers.
So,
oh, go ahead, Tamara.
So I guess we could say like a tap water or a city water control was included in both of the years that I sampled. This water was by far had no pathogens and then the least amount of antibiotic or metal resistance genes. And the chlorine residual was always very high. I had to take the sample and then dilute it in half with deionized and dechlorinated water to actually read on the chlorine levels on the chlorine machine, and then multiply that by 2 because I had to dilute the water in order to actually get a chlorine reading. So these, I guess you could say, these other systems that perhaps are not as maintained or vetted for as say we would like the actual drinking water infrastructure that are hooked up to municipal chlorinated water systems, still have, I could say, very high quality water running through them.
And Anita and Nancy, did you have any comments on this question?
Sure. I think as Dr. Sharvelle described, that's kind of our viewpoint as well. There are certainly other risks out there, from animal waste or other things, but these are the systems that we've studied. These are under more scrutiny, as she said, and the risk level, as I mentioned, there are different benchmarks. If the benchmark of 1 in 10,000 infections per person per year is considered too high, it could certainly be adjusted. It kind of depends on what the community is willing to accept. So, there's a lot of options out there, and there are questions to explore yet.
We have so many more good questions, you guys, and we are out of time. I'm gonna quick wrap this up with this closing question, but I do want to let participants know that we're going to be sending these questions to all of our panelists and allowing them to provide a written answer that we will then share with you via email. So here you guys go. Here's your closing question, and I'll point to you guys one by one. What key takeaways would you give to our audience that they can use in their day-to-day jobs to improve the public safety of their current or future stormwater reuse systems? And I will start with Nancy.
Sure. So I guess one of the main messages that I would have people take away is that, this is relatively new in Minnesota. We're still all learning about it, and we need to keep learning. And I guess I would be open to, like I said, maybe sharing information among water system owners, if they'd be willing to do that, kind of sharing tips and what they've been finding. And yeah, we need to kind of continue to explore some of the questions that we don't have a lot of information about yet, like cost analysis and what is the optimal treatment or the best way to analyze whether there's a pathogen there. Some of these methods are expensive, so finding a good way to figure that out is something that we should all kind of work towards figuring out together.
Great. How about you, Anita?
Yeah, well, I guess from the discussion here, I mean, we can see that it's, microbes are difficult in any setting to study and predict and understand, and it's going to be hard to nail down the exact numbers. We want to say, what are the exact numbers to make this safe? But I think we know enough, that most of the studies are indicating risk, and we have some ways that we can manage that, again, by choosing your source, thinking about how you're going to use it, and what are the controls, whether it's treatment or management, to make it safe. And that if we can focus on those things going forward, that I think we can really implement this practice and get the benefits out of it while maintaining safety.
Excellent. Satoshi, do you have some key takeaways?
Yeah, I want to say something positive about stormwater reuse. So stormwater reuse has a great opportunity and to good aspects to protect environment. And there are some potential risk of infections, but the system is highly variable, and the source and reuse purposes are also variable. So depending on the source types and reuse purposes, yeah, we need to select the appropriate treatment. But if that goes well, I think the reuse of stormwater is a great approach.
Okay. Tamara.
I'd like to echo Dr. Ishii's comments. I think there's definitely avenues for this, and avenues that would be like less cost than hooking to municipal water. We just, I guess, there needs to be a consensus on acceptable risk levels and unacceptable ones. And while I guess a lot of times I think decisions are going to be made on the conservative end, that it is prudent, but we will still be able to derive benefits from stormwater reuse, even though if restrictions are, say, heavier than maybe what is, than what in many cases it seems like there need to be, just because of the unpredictability and the variability. Just because of that, and any cautiousness around this does not mean that it can be implemented and that we can receive the benefits from it.
Thanks, Tamara. All right, Sybil.
I'd also like to highlight the tremendous benefits of stormwater capture and use in terms of serving as a water supply. And I didn't talk about it today because it wasn't the focus, but in a lot of the research that we've done, of all of the different water supplies, when there is storage available for stormwater, it has tremendous potential to meet demands in cities, even compared to reclaimed wastewater. So I think there are a lot of benefits to stormwater capture and use. I think we just have to understand that there is a lot of complexity with stormwater quality, and as Anita suggested, we need to find ways to manage that potential risk that over and over the data do show that there are these potentially pathogenic organisms present there, but that can be managed, and we need to seek for ways to consistently and pragmatically manage those risks so we can make use of this really beneficial source of water.
Great, thank you so much, Sybil. All right, so a virtual round of applause for all of our panelists. Thank you so much for sharing your work and your recommendations. For all of our participants, again, we're going to be sending you the questions that we sent to our panelists for some additional follow-up. I am also going to place a survey, I think, maybe quickly in the chat. So please take a few minutes to fill this out, which we'll use to tailor future research projects. Let me just take a second to throw it in the chat here, if I can. Maybe I can't. There we go. Great. Okay, so the link is now in the chat. If you could fill that out, that would be fantastic. Thank you again to all of our virtual panelists. And again, like the next presentation that we'll have is part of the seminar series with Ken Schiff on October 13th. We hope you join us then. And thank you all for joining us today. Thanks again to our panelists. This was such a great discussion.